worship you. I need you to
change me.
Jesus, change
me.
Like only you can, Lord. Change
me.
Is anybody out there need the Lord to change something about you? Change
me.
Whatever's not like you, Lord, I want you to
change me.
Do it for me, Lord. I dare you to just put your hands on yourself. Lord, I want you to change me. Like only you can, Lord. Change me. Can y'all help me say it? It's easy. I need you to. Oh, come on. Say it like you mean it. Change me. Whatever's not like you, Lord.
Good evening, everyone, and welcome to the presentation, Don't Be Still, My Beating Heart, How to Promote a Healthy, Happy Heart, which is Beta Omega's contribution to promoting heart health. I am Omega Tillman, and I am not the Kamala Harris of the chapter. I am, however, the second vice president of Beta Omega, and on behalf of our president, Dr. Wana Highshaw, I would like to take this opportunity to thank you all for taking time out of your very busy Zoom schedules to join us on this evening, because I'm sure at this time, each and every one of you are all Zoomed out. As you know, February is American Heart Health Month, and heart health is a primary focus for Alpha Kappa Alpha, especially within our communities. So tonight's presentation is our contribution to encouraging and educating you on ways to promote your heart. It is our prayer that in this time of COVID-19 and social distancing, you all are staying masked up, safe and healthy. And we hope that the information provided on this evening will arm you with the necessary information and ammunition to combat heart disease and continue to live healthy lives. I will just ask that you place your devices on mute so that only the speaker is heard at the time, and just to avoid any additional feedback. Again, thank you all for joining us on this evening, and enjoy the program. We'll now have the occasion by our Target 2 chairman, Mrs. Pamela Peppers.
Good evening, friends and family. It gives me great pleasure to be here tonight and to guide our minds toward thinking about our hearts. Oh, our precious hearts. My name is Pamela Peppers, chairman of Target 2, Women's Healthcare and Wellness. Alpha Kappa Alpha Sorority Incorporated, Beta Omega Chapter, Target 2, Women's Healthcare and Wellness will give you information about, oh, our precious hearts, and some things you can do to keep your heart in tip-top shape. Mrs. Thelma Crawford will introduce you to our speaker for this evening. Thank you.
Good evening and welcome. It gives me great pleasure to introduce to some and to introduce to the rest of us, Dr. Veronica Unworthy. She is a graduate, she is from California. First, let me say, I call her our Cali doctor, but she is from California, hails from California, and she went to school at Spelman and majored in biology and graduated in 3 years, and later got her doctorate degree from Baylor in 2003. And she's been practicing medicine ever since. She's board certified in family medicine, and she does to do family medicine. She takes care of babies to grandparents. I guess I fit in there. And she loves pediatrics and women's care. So in her spare time, she loves reading and exercising, and that she is married. She has time to be married, and she has a stepson. And so we are so proud of her, and we look forward to hearing from her tonight. Dr. Veronica.
Thank you for that generous introduction. It is my pleasure to be here. I'm honored to be asked to be here. I will tell you up front that I do not know everything, but I am glad to share with you what I know and hope to grow your knowledge about your heart and your health and your blood pressure and how to stay healthy. So I appreciate all of you taking the time to spend with us today on this Zoom. I'm going to begin to share my screen here so you can see the slides. All right, so don't be still, my beating heart. How to promote a healthy and happy heart. Again, I practice here in the local Kansas City metro region. I'm a family practice physician. I've been practicing for over 19 years. I also am a hospice director for Catholic Community Hospice in the area. So again, it's my pleasure to be here. While I am a physician, I am not your physician. So it is against the law for me to give medical advice, but anything that you learn here today, I strongly encourage you to go back and take it to your physician to ask questions regarding your specific care. But again, it's my pleasure to be here. So let's start with the myth. The myth is that women don't really need to worry so much about heart health, right? Heart health is a men's issue. We hear this all the time with young men having heart disease and sudden heart attacks. But women, we have to worry about this as well, unfortunately. Heart disease is the leading cause of death for women in the United States. That means 1 in every 5 females will pass from heart disease. Sorry. Also, most importantly, heart disease will affect 1 in 16 women over the age of 20. So 1 in 16 women will have some degree of heart disease. So it's important for us to really acknowledge that this is going to be a factor for many of us as we get older. The difference for women is that, unfortunately, the symptoms can be very different. Sometimes you can present with no symptoms, and the first event is your event, and maybe even the last event. So it's important that we educate ourselves toward heart disease prevention, because sometimes there are no symptoms for heart disease. The other issue is that sometimes you will have symptoms. You can have chest pain, chest pressure. It can be a dull, squeezing ache. It can be a heaviness. It can be a sharpness. It can be very vague. Okay, so if you're having symptoms of chest pressure or chest pain that are vague, that are worse with activity, pay attention to that. Follow the pattern. Also, it can present as pain in your jaw or your neck or your throat, pain in your upper abdomen, or pain that shoots all the way into your back. It can also present with just something as simple as nausea or vomiting or feeling tired. So again, it's important not to minimize your symptoms and to pay attention to your body if things are changing. Let's break this down a little bit further. Again, we know men deal with heart disease, but women do too. So men tend to present with heart disease in their 40s and 50s. But women, if you'll see here on this graph, let me just get my pointer here 1 second. Okay, if you see on this graph kind of in the middle, that men and women start to equalize each other with the cardiovascular risk in their 50s to 60s. So men and women will approach each other with regard to their cardiovascular risk in their 50s to 60s. So it's very important for us to pay attention to. As we get older, our heart and cardiovascular disease risk will go up. The important thing here is too, after the first heart attack, 23% of women will pass away in their first year. So this is the disease that we need to prevent. 23% of women after their first heart attack will pass away in the first year. At 5 years, 50% of women who have had a heart attack may pass away. So again, prevention is key. What we learn here tonight is key. We're not going to be perfect, but every step we make in a better direction is going to be a much more healthier for us. Overall, your heart is a pump. It is a muscle. It needs oxygen. It needs blood flow. We don't want to overwhelm our pump. It has a shelf life. It's only going to last so long. So everything that we do over our lifetime to protect our heart pump, to protect our heart muscle is key. Through this graphic, you see the blood enters the right chamber, exits out to the pulmonary tree where it gets oxygenated, comes back in and will leave through the left side. Also from this graphic, you can see those flashing lights. There's an electrical impulse that has to travel through the heart at the right place, at the right time in order for your heart to function normally. So we want to do everything we can to protect our heart pump. There are 4 ways that your heart can get sick. 4 primary ways rather, that your heart can get sick. The first being the plumbing or the arteries. So here's your typical heart graphic. It's made to look like the anatomical heart. And right in here, you see this blood vessel here, and the blood vessel can get blocked with clot. This vessel is called the left anterior descending. You don't need to remember that, but this is one of the more primary areas where your heart can get blocked. This is what they call, unfortunately, the widowmaker, because men will present with a clot right in the early part of this vessel, and that could be their first and last presentation of their heart attack. So again, prevention is key. Prevention is key. The other main artery that can get damaged is the right coronary artery that sweeps around to the right. So we want to prevent the clots in the arteries to promote good blood flow to the heart, to keep that heart muscle healthy. Secondly, you can have a heart rhythm issue. So on this graphic, you see that there's a green lines, and the heart electrical impulse enters from one area, bounces to the next area, travels down these lines called Purkinje fibers, which you don't need to remember that. And that's how the heart will beat with the coordinated flow, okay? If that heart electrical impulse bounces around and shoots off in the wrong area, your heart cannot beat in a coordinated manner. So it's very important that the electrical impulses of the heart are maintained in their normal track. If the heart gets stretched over time from high blood pressure, if the heart gets stressed over time from other disease, the electrical impulses don't flow where they're supposed to. And if the electrical impulse does not flow where it's supposed to, the heart cannot beat in a coordinated fashion, and that can cause heart disease. The most common way for that to be problematic is called atrial fibrillation. As we get older, the risk for atrial fibrillation or irregular impulse rhythm is because as we get older, the heart can get stretched. Another way your heart can be damaged is if the mechanics can fail. So we have something called heart valves, and down here in the lower left side, you see that the heart valve should be open, and at other times it should be closed. So this is normal, your normal heart valves. Your heart valves, unfortunately, can get sick. As we get older, things that get older tend to calcify or get hard. So you can get plaque or calcium around your heart valve. The heart valve can wear out as you get older. Typically, this starts in our 60s and 70s, and it can become blocked from too much calcium. You see that narrow hole? Well, that narrow hole can't accommodate as much blood flow as this big open space. So heart valve stenosis is a reason that the heart can get damaged. Another thing that can happen is the heart valve can get torn up or frayed over time. The heart valve can stay open slightly. We call this valve regurgitation, where the heart valve is open for some reason. Maybe it got damaged. Maybe you were a kid with rheumatic heart disease, and that caused your heart valve to get torn up and frayed. And so the valve didn't close completely. It stays slightly open. And so blood flow is coming into the chamber when it's not supposed to. That's going to make the heart work a whole lot harder. The other thing that can happen to damage your heart is your heart can develop something called congestive heart failure, congestive heart disease. And so here in this last graphic, we see a normal heart. And over time, that heart muscle can get stretched or enlarged. Why would the heart muscle enlarge? The number one reason for congestive heart disease is a heart attack. If a heart attack, which we showed earlier, takes out this whole area of the heart and that part of the heart dies, the body tries to accommodate. The body is very accommodating. It's going to try to catch up. It's going to try to compensate. And what it's going to do then is grow. The heart muscle is going to grow. The remaining heart muscle is going to grow. And as it gets bigger, unfortunately, you see here, it crowds out the space. This space is a lot smaller than the other space. So an enlarged heart does not accommodate as much blood flow. And then when you need to exercise and do more activity, you don't have enough blood flow. So you feel tired and weak and lightheaded because your body can't keep up because the heart muscle is damaged, even though it looks like it's too big. So that's how the pump can fail. So what we want to do to keep this heart pump healthy is to prevent the heart from ever having compromise in blood flow. So how do we compromise blood flow to the heart? Well, stage 1 heart disease is primarily promoted when we start to get elevations in our cholesterol and our blood sugar. Cholesterol and blood sugar. I like to say greasy blood or sticky blood. Now, it's not exactly that way, but you can imagine when you've cooked something on the stove in grease and the grease gets all hard, when you try to go pour that out into the trash, you know how slow that is? So obviously grease and fats in the blood stream are no-go. They slow the blood transmission down, and the slower the blood is, the more blood will stick together. The slower the blood is, the more we can promote clot formation. And we'll talk about clots here in just a minute. The other thing is high sugar. Think of high sugar or diabetes like syrup. Again, if you're pouring out water, it goes really fast. If you're pouring out syrup, it goes very slow. So slow blood, sticky blood slows blood flow, and slow blood flow causes plaque to get laid down in arteries. The higher your cholesterol, the higher your blood sugar, the more sludge you're going to build up in the arteries. Sludge over time will get hardened and calcified, and that will lead to stage 2 heart disease, where you've developed a plaque in the arteries. It's a soft plaque. It's full of cholesterol and sugars, and the body knows it's not supposed to be there. The body says, I'm going to go fix that. So it sends out pro-inflammation cytokines, which are chemicals that are trying to get the body to fix the area, but it can't fix the area because we keep eating sugar and we keep eating too much cholesterol, and we keep laying down more plaque. In this country, we're blessed. We have a wonderful diet. They have shown, in fact, by age 11, we start to build plaque in our arteries. That's how good our nutrition is, or how bad you might say our nutrition is. By age 11, you're starting to lay down plaque in your arteries. Over your lifetime, as the plaque gets bigger and bigger over the many, many years, the plaque will harden and it will slow blood flow. Slowing blood flow can ultimately lead to atherosclerotic plaque, or plaque in the arteries. The plaque in the arteries can become significant when it's about 60%. One day, that hard plaque, the longer it's there, will calcify. We said things that get older get calcium deposits on them. They calcify. And one day, that plaque will rupture. And that's where you go from slow flow heart disease, where you have symptoms, to heart attack, block the whole artery. Now, Houston, we have a problem. So stage 3 heart disease is plaque rupture and complete blockage of the vessel. So how do we prevent most of these things? We prevent it by addressing our cholesterol, addressing blood sugar issues, and then secondarily also watching our blood pressure, avoiding excess salt, and reducing our stress, okay? Here's another graphic that shows what we're talking about. Again, we start off with open, healthy, clean blood vessels. Then over our lifetimes, we deposit fats in the wall. The fats get bigger and bigger, and they can lead to near blockage of the arteries. When you block the artery about 60%, you get something called angina. Angina is the fancy way of saying chest pain. So when I do activity, I hurt, I'm tired, I can't catch my breath, and it gets worse and worse as time goes on. That kind of blockage in the arteries is what we feel when we see blockage in the heart. But this is the same process that leads to blockage in the brain. It is the same process that leads to early stroke as well. So you can get brain symptoms in addition to having chest symptoms when you're building up plaque in your arteries. This same process also leads to something called peripheral artery disease, where we're blocking off the blood flow from the heart down to the legs. So when I walk with activity, my legs feel like I have cramps. I feel like I ran a marathon. I get cramps in my legs just by doing simple activity. That's called peripheral artery disease. It's all a part of the same process. Now, if I show you stuff in threes, you'll remember. So again, start off with normal arteries. Over time, fat will build up in the fat cells. It's actually fat cells that soak up fat called foam cells lead to a fatty streak. The fatty streak will lead to a soft plaque called a fibrous plaque. If you look at this graphic here, you'll see in the middle that the plaque is getting bigger and it's got a white shell around it. It's starting to get calcified. So the plaque will grow over our lifetimes the more we eat the wrong foods. Then that plaque will calcify and it becomes hard. It turns into atherosclerotic plaque. It goes from an arthroma, a soft plaque, to a hard plaque called an atherosclerotic plaque. Again, with activity, if your vessel, the opening is blocked, if it's reduced by 60% of what it should be, in general, you get those symptoms called angina, that chest pain with activity, that chest pressure with activity, that heaviness into your jaw, that shooting pain into your back, that I'm so tired, but I didn't do much activity. If that's been the pattern, that can be a sign of heart disease. Or it can cause TIA, which we commonly refer to as a transient ischemic attack, which is a mini stroke. Maybe this has happened to someone in your family, where all of a sudden their face droops and they can't say the right words. And then it goes away and they think they're fine. But actually, that's a warning sign that they could have a stroke in the next several months and they need to go see their doctor, or they should go into the ER. Same process that causes plaque in the heart will cause plaque on the brain and lead to stroke. Finally, again, peripheral artery disease, that heaviness in your legs with minimal activity. That is what happens over many, many years if we don't address our cholesterol and our blood sugars. One day, that all that sludge and slime and grease in the arteries will break. It'll break open and the body says, whoa, that's not supposed to be here. All those inflammatory cytokines that were trying to heal that plaque over time but couldn't because it was getting walled off by calcium. The body says, wow, there's an injury here. I need to go fix it. And what it will do is send out policemen to go fix the injury. And so it'll start to build a clot, and it builds a clot very quickly. And in minutes, now you've blocked off the artery and there's no flow and you have a heart attack or you have a stroke. So this is all prevention. We have to prevent this process. So I have a few cases here just to kind of illustrate the point. These cases are a little bit overblown, so you really just get the concept. So I want you to meet All Cholesterol Paul. Mr. Paul lives by fat is flavor, and he does not eat in moderation. He has processed meat for breakfast, like bacon and ham. Then he has a burger for lunch or a steak for dinner. He butters his bread, keeps Crisco by the stove to make all of his other foods taste better, and he would eat processed red meat every meal if he could. Now, this is not most of us, but we know people who love grease, love cholesterol. We have gotten lots of mixed messages from the health community with regard to fat. Honestly, keto can be helpful for some people, but it's got to be the right patient. I included a nutrition facts profile here, nutrition label, so you can start to really look for the ways that you can protect yourself when you're eating your food to prevent excess cholesterol, excess lipids. The difference between fat, lipids, and cholesterol is only made by animals. So we as human beings are born with a certain amount of cholesterol genetically. And then we also get cholesterol from the animal products that we eat. So if we're born with high cholesterol and we eat high cholesterol, Houston, we have a problem. So cholesterol and lipids or fat are not exactly the same thing, but you want to try to limit your cholesterol overall. When you're reading the food labels, you want to try to avoid trans fats. Trans fats tend to be the fats that at room temperature are solid. They look like hard grease. You can imagine a fat or grease at room temperature that's solid on your stove is going to be solid in your arteries. Slow blood, greasy blood, fatty blood creates inflammation, creates plaque, and it slows everything down, and we don't want slow flow through our arteries. The next case is Miss Sweet Tea. Miss Sweet Tea is as sweet as sugar, and everybody knows it. She makes baked goods all day and tastes each one of them before she hands them out to her family and friends. She has gained 10 to 15 pounds every single year, and she's getting around much more slowly. Her vision has started to get blurry, and her eye doctor teases her that her blood must be thick like syrup because she's having vision problems with her eyes. She is urinating all the time, and she's thirsty all the time. She is avoiding going to the doctor because she doesn't want to know if she has diabetes. Again, this is a bit of an exaggeration, but you may know people like this. When your body can't metabolize the sugar that it's dealing with, sugar will start to stick on things. It will literally start to stick on things. And your body will come up with other ways to get rid of sugar. So people who get diabetes with uncontrolled diabetes, they tend to urinate all the time because their body's trying to get rid of that sugar. They're thirsty all the time because they're urinating all the time because their blood is thick like syrup and it wants to be thin like water. So your body is trying to dilute that sticky blood. It's trying to keep up with all the fluid that you're losing because you're urinating out so much because your body's trying to get rid of that excess sugar. So again, you want to try to keep your sugars and your carbs and things down to a minimum. Meet Salt Me Sally. Miss Sally loves salt. She adds salt to her food even before she tastes it. She often wonders why her hands and feet get so swollen by midday. She gets splitting headaches from high blood pressure, and she gets this pressure buzzing in her ears when the room gets quiet. She has chest pressure. She feels short of breath with simple activities. And when she's breathing, her family says that her lungs sound like they're wet or gurgling. So salt, I've included a label here that shows you how to see how much salt is in your food. What's the real problem with salt? The real problem with salt is that salt makes you hold on to water. So the more salt you have in your life, in your diet rather, I should say, the more water you're going to hold on to. The more water you hold on to, the more you're going to make that heart pump, which I said, you only get one heart. It has a shelf life. So the more you make that heart work harder than it needs to, by doubling and tripling its load, it's going to wear out more quickly. Too much salt causes high blood pressure because you're saving more water than you need. Too much salt and extended high blood pressure will wear the heart out faster than it needs to and increase your risk for heart failure and increase your risk for stroke. If the heart is having to work harder than it needs to, it tends to stretch as well, and that can increase your problems with rhythm disorders like the atrial fibrillation that we talked about, by the heart muscles getting stretched, fibers getting stretched apart, and now the electrical impulse doesn't go where it's supposed to go. So having too much salt creates high blood pressure. High blood pressure can lead to risk for heart disease. The other big thing about salt, which causes high blood pressure, is blood pressure is a pounding force. Okay, so every time you're roughing up, as blood goes through the artery, you're roughing up the surface, and the surface gets irritated and aggravated, and it creates inflammation. We said that we know we're already putting down plaque in our arteries from cholesterol, to high cholesterol, I should say, and high blood sugars. Well, if you're roughing up the surface and you're pounding the force, you build up plaque in your arteries faster. And so that's why high blood pressure is a big no-no, and it aggravates high cholesterol and high blood sugar. Your doctor harps on blood pressure, cholesterol, and blood sugar at every yearly visit because those things together are a terrible combination. Those things together lead to increased plaque formation. Now, one more thing going back to this label here. In a quarter teaspoon of table salt, that's your Morton's salt over the counter, at the grocery store rather, it has nearly 600 milligrams of salt. A quarter teaspoon, baby little bit, has 600 milligrams of salt. Well, how much salt should you have? Patients with high blood pressure are told to try to keep their salt under 2,500 milligrams of salt a day. So one little quarter teaspoon gets you, a fourth of the way there. That's a big deal. Now, if you use sea salt in moderation, the comparison of a quarter teaspoon of sea salt versus a quarter teaspoon of table salt, sea salt only has about 400 milligrams of salt. So you can use less, and it actually has more potent flavor and tend to stay under that 2,500 if you're somebody who has hypertension. So it is a big deal. Wherever salt goes, water goes. And if there's too much water in your system, your blood pressure goes up. If your blood pressure goes up, your heart pump works too hard and you wear your heart pump out faster. Okay, last case here is Mr. Sky High Pressureton. Sky High has high blood pressure, but he doesn't know it. In fact, he feels fine. Blood pressure is a silent killer. We talked about our last patient who had that buzzing in her ears, but most people really don't feel bad from high blood pressure. They don't even know they have it. It's a silent killer. We talked about all the ways high blood pressure damages the blood vessels. What's the definition of high blood pressure? High blood pressure is 140 over 90. greater than 140/90. Now, as you get closer to that number, they call it pre-hypertension and all that. But when you're consistently over 140/90, that's high blood pressure. The longer you have high blood pressure, the more roughed up surfaces in your blood vessels you're going to get, the more pro-arthrogenic, pro-plaque formation, pro-heart disease and stroke you're going to get. From this graphic, you can see, again, the high blood pressure leads to increased risk for heart attack. It leads to heart failure because it makes the heart pump wear out too fast. It leads to clot formation, which we've talked about, not only in the vessels, but in the brain. This is the same process, happens in the brain. It can cause what we call an embolic stroke, a clot type stroke that will go down to the smallest vessel into the brain, and everything downstream from that has no more flow. And so that area of the brain will die. And if that area of the brain dies, then you can have permanent damage. The other thing that high blood pressure affects the organs with the tiniest blood supply. Your kidneys have the tiniest blood supply. They're filters. So the micro vessels, the tiniest blood vessels in your kidneys, that pounding force destroys those tiny blood vessels. And so you start to get kidney damage from high blood pressure. The other thing is it can destroy the back of your eye. Your eyes have tiny blood vessels. And so the eye doctors are right when they tell us that they can see these things like heart disease and stroke and even diabetes coming 10 years before your primary care doctor can see it, because the eye doctor can dilate your eye and look at those tiniest blood vessels in your eye and see where the vessels have already been damaged or nicked or aggravated from high blood pressure or from blood sugars, high sugar causing little clots in the artery, or high cholesterol causing little yellow deposits or fatty deposits, which block off the blood supply. So again, going to the eye doctor, having them dilate your eyes can see this stuff coming 10 years before I can see it, because it looks at the micro vessels. If you go to the doctor and you get a heart lab work done and they do a kidney test and it shows something called your GFR, which you don't need to remember exactly, but if it shows that your kidney function is declining, that may be a sign that there's been some long-acting blood pressure, silent blood pressure going on for longer than you realize. And so if your GFR, if your kidney function is declining, there may be something more serious there. So what do? You want to get a blood pressure cuff. They're not expensive. They're about 30, maybe 50 bucks at the grocery store. Start to check your pressure. If it's high one day, that's not a big deal. What we care about is the trend. If it's staying consistently high over time, high in the morning, high at night, greater than 140/90 consistently over several weeks, then that can be a diagnosis of actual hypertension, and you want to go see your doctor to prevent all these things that can come downstream from untreated hypertension. Okay, a few words about toxins, stress, and hormones. Your body is made to adapt. If you are a worrier, a stressor, everything bothers you, your body will adapt. It's going to make cortisol. Cortisol is your stress hormone. Cortisol, by definition, way back in the day, was there to help you run away from a dinosaur, theoretically, right? You need a lot of energy, you need a lot of strength to get away from that dinosaur or other major catastrophic event from the big animals that would eat you. So cortisol is going to make your heartbeat faster. Cortisol is going to raise your blood pressure. Cortisol is there around, or adrenaline is there to save your life. If you're washing your heart in adrenaline and cortisol constantly because you're a worrier, your heart feels stressed out. You know, it's like when stressed out people walk in the room and it just brings you down. Imagine doing that to your heart every single day. If you're a worrier, you really have to try to see your doctor or to see a counselor or do something to try to get that excessive worry to go down, because your heart has a shelf life. It's only going to last so long. If it constantly thinks it's going to be running away from a dinosaur, it's going to wear out too quickly. So try to reduce your stress. Accept the things you can change and let the things go that you cannot. Because if you can't change it, you're just making yourself sick. And you actually can make yourself physically sick. The other thing about hormones is that when you're young and you're making estrogen and you're making testosterone, those hormones are actually heart and brain protective. as we get older, we make less estrogen, we make less testosterone, and that leads to the vessels in our arteries being roughed up and frayed and more fragile. And so hormones are heart protective. That's why women rather get heart disease later than men, because we don't go through menopause until our average 50s and 60s, or early 50s into our 60s. So once the hormones are gone, that heart protection is gone. And now our risk approaches that of men. And that's why I like to say menopause, because once you go through the change, after 3 years of going through the change, your risk for heart disease is going to actually start to approach that of a man. And we learned that on the first graphic that I gave you. I showed that cardiovascular risk for men and women approach each other in your 50s and 60s. And that's why. That's the reason why. So hormones can be heart protective. If you're someone who's going through menopause and has other symptoms of menopause that are miserable, like hot flashes and low energy and changes in your sleep and painful intercourse, all those things, if it's appropriate to start hormones and you accept the risk of hormones, including higher risk for breast cancer potentially, and there's no one in your family who has gynecologic or breast cancer, things like that. If you're somebody who can take hormones safely, you may want to consider taking hormones safely with your doctor, not for protection against your heart, but as a secondary benefit. Again, you're taking them for your hormone benefits, not the secondary benefit is that it also will protect your heart and protect your brain from stroke, protect you from heart attacks. Again, it's never a reason to start hormones. We don't give hormones to women or men to protect against heart disease or stroke by itself. If you've gone through the change and it's been more than 3 years, you do not want to start hormones, because again, you've gone through menopause, your body has changed. And now after 3 years, if you give someone hormones outside, it can increase your risk for heart disease and stroke. So just a little caveat about that. The final way that your heart can be damaged is from infections. We call an infection of the heart myocarditis. You see in the graphic normal heart, healthy heart muscle cells called a myocyte. If there's lots of inflammation, your myocytes get damaged, they get skinny, they get frayed, and they cannot function as well as they used to. Myocarditis, again, is the definition of an inflamed heart. We see this sometimes after viral syndromes. We've even seen this with COVID, even though it's not well described. There are some patients with COVID who we're calling long haulers who have some secondary damage from the COVID. We don't know how long that will last, but we're seeing that. The classic examples are other viral infections that can lead to myocarditis, but we are seeing some of this. Rheumatoid, we talked about, is one of those kinds of inflammation that can damage the heart. What we want to do is prevent infection. How do you prevent infection? Well, you can support your immune system. One of the best ways to support your immune system is getting good sleep. Sleep is not optional. Good sleep is an imperative. You've got to get good sleep. It really supports your immune system, which will help protect your overall health in general. The other thing you want to do, of course, is to eat low inflammatory diet. So an high inflammatory diet would be, again, things with lots of sugar, things with lots of cholesterol, processed foods. Those things create inflammation, which can increase risk for infections. You want to get regular dental cleanings. They've shown that people with gum disease are at significantly higher risk of heart disease, okay? The slow influx of bacteria from the gums can overall damage the heart slowly, which can make it easier for you to get problems with your heart. So also get regular dental cleanings. So what do? How do we protect ourselves? You want to make sure that you're getting regular screening. When you see your doctor, get your blood pressure checked, or be proactive and buy a blood pressure cuff on your own and follow the pattern. Again, we want to see blood pressures that are typically in the 120s over 80s, ideally, definitely not greater than 140 over 90 consistently. When you go to your doctor, also get your cholesterol checked. We said some cholesterol is genetic. You're born with that. You're born with cholesterol. The other cholesterol you eat. So you want to make sure that you're getting a fasting lipid panel, that's no food after midnight, I usually say, or no food for 8 to 12 hours, because that's going to show you how good your body is at your inherent cholesterol metabolism and what's floating around in your bloodstream. Your triglycerides literally mean how much fat is floating around in your bloodstream. The HDL is your good cholesterol. The higher your HDL is, the more protected you are. HDL that we aim for is greater than 40. Typically an HDL greater than 40 is protective. Towards the same end, an HDL or good cholesterol less than that in the 20s or 30s can be pro-inflammatory, which can increase your risk for heart disease. The other thing is the LDL. LDL is your bad cholesterol, low density lipoprotein. What does that really mean? Tiny, tiny, tiny little particles of fat that are floating around in your bloodstream. Your body is inefficient at getting rid of cholesterol. So the smaller they are, the harder it is for your body to get rid of it and eliminate it. So low density lipoproteins are no good. The higher your LDL is, the higher your cardiovascular risk. Now, when you go see your doctor and they do a blood pressure and a cholesterol on you, they can also do something additional called an ASCVD score. You don't have to remember that, but just there is a way for people over age 40 to put in your blood pressure, put in your cholesterol numbers, put in whether you have diabetes, put in your gender and your race, and it will spit out a number that says over the next 10 years, my risk for a heart attack is X, Y, or Z. Okay, that's a lot of information just from blood work and a blood pressure. And that's based on all the historical data. If your ASCVD score, it's something that your doctor can do, is approaching 20s and 30s, that's a red flag. That's something where maybe you need to definitely get some intervention going on with lowering your cholesterol, lowering your blood sugar. If you're on the border and the abnormal number is on the border, then you can go for additional testing. Maybe you'll get a cardio scan. A cardio scan is a quick x-ray that says how much plaque is in my arteries now. We said as plaque gets older, it calcifies. So it actually will measure the level of your plaque in your arteries for not that much money and show you estimate what your heart disease risk would be. And then you can proceed with additional diagnostic testing. But those are the ways you can really get at that answer of, am I at risk or not? Being of a healthy weight. Now, this is genetics. Again, a lot of us are born thin, a lot of us are not. So be the healthiest weight that you can be. Ideally, you want a BMI that's less than 25. That's your height to weight ratio. But if you're not that, don't give up. Lose 10 to 15 pounds. Work on that 10 to 15 pounds. Even losing a little bit of weight can reverse a lot of these cardiovascular risk factors. Get your blood sugar tested regularly. Eat a healthy diet that's not pro-inflammatory, less processed food. If it's in a package that's at the grocery store, just say really quickly, when food is at the grocery store, it's made to be shelf stable. It's processed. That's what process means. How shelf stable? How long can it sit on the shelf before it deteriorates? Well, all those things that they do to make food shelf stable confuse our bodies. And when our body sees preservatives and trans fats and all these things that they do to make the food live longer on the shelf, that kind of thing causes inflammation in our bodies and increases our risk for heart disease. So you want to lean toward a whole food diet where food looks like what it came out of the ground. It looks like a vegetable. It looks like a piece of chicken on your plate. The more processed it is, the more you had to tear it out of a package. In general, that's what's going to increase your risk. Try to get regular physical activity. And the goal we say is 150 minutes through the week, 150 minutes added up through the week. But they've even shown that even 10-minute spurts of activity here and there, when you add it all up, is much better than getting no activity. The people that have even 10 to 15 minutes of activity have way less cardiovascular risk than the people who don't do anything. So do your best. Do your best. Start someplace and keep working towards a bigger goal. Just to review, for women, the symptoms can be a little bit different. We said that hormones can be heart protective. Women can have, of course, men and women get chest pain or chest discomfort, but sometimes it's just being tired. Sometimes it's just sweating. Sometimes it can be shortness of breath with activity. Again, it can be as simple as nausea, vomiting, or stomach pain. You know, kind of not specific, but if it's consistent enough, you need to talk to your doctor about it. So what we need to do is advocate for yourself. When you see the doctor has a lot of things calling for their attention. Make them focus, okay? Make sure that you're being heard. Check a cholesterol level, check a blood sugar. Say, hey doc, if your doctor forgets, make sure that you remind them, it's time for my blood work. You wanna know what your risks are, okay? If you're having symptoms, don't let the doctor ignore you. If you had to go to the ER, for example, don't let them write it off as anxiety without doing some simple tests. Maybe they'll do an EKG. Maybe they'll do some labs, but there are ways to really get at answers. Don't just say, oh, well, it's just heartburn or it's just anxiety. And it may just be heartburn or anxiety, but the key is you want to get answers. If you're having consistent symptoms, don't let anybody blow it off. You be your best advocate. Say, well, I appreciate, doc, that you think it's anxiety. I appreciate, doc, that you think it's heartburn, but should we do any heart test? Simple question. Okay. And if they say no, but you're still having symptoms, maybe you want to go see somebody else. Okay. That doesn't mean get tested all the time. Once you're tested and things look good, the tests tend to be good for about 5 years, 3 to 5 years. But if you're having symptoms, don't let anybody blow you off. Advocate for yourself by communicating as best you can with your provider. Advocate for yourself by choosing a healthy diet, low whole foods, less pro-inflammatory foods. Advocate for yourself by getting as much physical activity as you can. Again, ideally 150 minutes all week. But if you can get 10 minutes, then that's doing a whole lot better. Advocate for your families, okay? Because a lot of us, we don't talk about our health problems. They don't need to know. I don't want to make my family worry. But if you don't tell your family what you've gone through, then they can't learn. If you're having heart disease and heart issues and cholesterol problems, I guarantee you, they may also be having some of those problems. You may be older and you could avoid half of the problems that they're going to have if you just speak up about what you're dealing with. So I would encourage you to try to talk about your health in the way you feel comfortable so you can educate your family members so that they don't go through what you're going through. Okay. And then finally, be active in your community with regard to heart health. I don't know everything, but I share what I know. If you've learned something here today, share it with someone else. Donate to places like the American Heart Association. Volunteer where you can, because again, this is going to affect most of us. Men and women. And so we want to be proactive. We want to pass on what we know. And with that, I'll take some questions.
Okay, we have questions in the chat. And before Ms. Moore gets started with her ending process, I will ask some of the questions. First question says, are there any processed lunch meals that are not harmful?
That's a good question. I mean, in general, you want to try, if you can, and if you can afford it, get this cooked for yourself. If you can't, you might find things that are healthier choices by choosing organic, certainly reading labels, trying to get things that are locally sourced. Typically, if it's made local, it's not shelf stable. Again, the longer it sits on a shelf, the more pro-inflammatory it is. So if you can buy local from your smaller grocers, from your smaller health food stores, you're going to end up making healthier choices.
Okay, thank you. We're getting so many chats in that say this was so very informative. So we're appreciating this so much. The next question says, what about dairy products? Is milk considered processed food?
So milk, it can be healthy for you. It depends. Again, buying organic when you can is good. Milk, we need cholesterol. Cholesterol gets a bad rap, but again, our bodies are made from cholesterol. So we do need a certain amount of cholesterol. So if you're going to choose milk in your diet and you're not having allergic reactions from it, try to get, again, locally sourced, grass-fed cows where you can. Things like that are going to be less pro-inflammatory than the stuff that's, shipped across the country. But milk can be healthy for you. It's a great source of protein. It's a great source of calcium. It's a great source of vitamin D. But get the best that you can afford.
Okay, thank you. The next question says, what about Himalayan salt?
Yes. So the take-home message is when you can, avoid table salt. Avoid table salt wherever you can, or use a salt substitute. But yes, Himalayan salt, sea salt, those and the lava salt, those tend to be less potent than regular salt. Yes, but don't be heavy-handed.
Okay. Are sugar substitutes such as stevia okay to use to prevent sugar issues?
That's a complex question. I will say personally, I prefer stevia because it's made from sugar than some of the other pink and blue packets, because those ones are more processed. So if it's actually made from sugar, your body gets less confused. The better thing to do, in my opinion, would be to use natural sugars like agave or honey in a smaller amount.
Okay. Is the keto diet okay for heart health?
That is an excellent, wonderful, fabulous question. For some people, yes, it can be. And that's where, so again, the whole fat thing is a little bit complex, but you got to know yourself. You got to know your body. You have to speak to your doctor, because for some people, if you've been building plaque all these years and now you're also adding high cholesterol on top of it, and so you've got a smaller lumen, you've got a 60% blocked vessel already, and you're adding all this cholesterol in there in the short term, in the short term, your risk can be higher. So, but they've actually shown that the keto diet can be very successful for patients if you're actually losing weight. What is fat? Fat is stored energy. The keto diet is a stored energy fat diet. So your body stays in ketosis the whole time. So it constantly burns calories. And so if you're losing weight on a keto diet, long-term, the weight loss actually promotes heart health. But if you're on a keto diet and not actually losing weight, then you can't do it. Again, the keto diet for some people can be dangerous. It can hurt the kidneys. So you really want to speak to your doctor first.
Okay. Other than medication, are there ways or exercises that will decrease the size of plaque and other things that clog arteries?
So exercise helps, but the only thing that has been proven to reduce the size of plaque in the arteries are the high potency statins. And that's why as doctors, we love cholesterol medicine. I know patients hear cholesterol medicine, they just don't want to take a medicine, but it is the only thing that can reverse plaque over time. It is the only thing that keeps that plaque from rupturing. Again, we're all getting the plaque. It's just, we get there faster when we eat the wrong things. Cholesterol medicine not only lowers the numbers of your cholesterol, but it has what's called a pleiotropic effect. You don't need to remember that. But what you do need to remember is that plaque will fracture, plaque will break. When it fractures and breaks, that's what causes the heart attack. That's what causes the stroke. Statins, cholesterol medicine, stabilize that plaque. So even if you have plaque in your arteries, it makes it much, much, much harder to get a heart attack and get a stroke. So again, as a doctor, I lean towards medicine, and a lot of people feel like they can't take those medicines because they hurt, but it'd be better for you to take a small dose of one, even a little bit, so that plaque doesn't rupture. So we can use it not only just, yes, we want it to lower cholesterol, but some people can't take it for that dose. Some people, we just need it to stabilize that plaque so they don't go on to that heart event.
Okay. What steps can we take to help in our younger years to stay healthy?
So get the patterns down, right? Exercise, 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 eat real food. Try, we have busy lives. There's all these reasons to eat fast food. There's all these reasons to eat a packaged food. So, do the best that you can, but if you can get the patterns in of regular physical activity and eating foods that look more natural in general and not overeating, so you're not putting your body at undue risk long-term, eating smaller amounts, those are the best things you can do to promote heart health.
Okay. Will drinking excessive alcohol or a heavy drinker cause heart disease?
Excellent, excellent question. You know how your brain, I'm the only person in the room that has ever had a hangover when I was much younger. You know how your brain felt? Well, your heart feels just like that. You couldn't do anything. You went through your day slow and dragging. Alcohol is a toxin. Alcohol in excess, I should say, for women, less than 2 drinks, not heavy pours, not that big glass of wine that the restaurant gives you. 2 drinks or less for most women is actually heart protective. For men, it's 3 or less. Again, not a heavy pour. If you're not a drinker, don't start drinking to protect your heart. But excess alcohol will damage those muscles cells and will make your heart work a lot harder and make your heart age faster. You can get much higher risk for congestive heart failure with alcohol abuse, alcohol overuse.
Okay. What are the best exercises to promote good heart health?
Whatever you'll do consistently, that's the best one. Yes, pick something for you and just do it.
With so many symptoms, and many of those being symptoms you wouldn't typically associate with heart trouble, and an example of that maybe is nausea, when should you be concerned enough to consult your doctor?
It's really about the pattern. If you're seeing a pattern consistently over time, say a month or 2, where these things are happening consistently with activity, I should say. Nausea by itself is just nausea. But if you're active and you start to get nauseous, and it's a pattern where it's happened, once or twice in these last 2 weeks, that means that it could be a problem. So follow the pattern. If it's repeating itself, then it's probably not normal. Okay.
Okay, thank you so much. I think that ends our set of questions that we have now, and we have appreciated you being here with us tonight, and I'm going to turn it over to Miss Moore, Mabel Moore.
Good evening, and thank you so much, Dr. Veronica. I cannot express how wonderful, how great of a presentation that was. And so we're so thankful that you shared with us. And so I just wanted to say on behalf of Beta Omega chapter of Alpha Kappa Alpha sorority, thank you everyone that joined us this evening for this wonderful, wonderful, informative presentation on the heart. I mean, the information is good. We need to do it again as soon as we can. But I just wanted to say thank you all so much for joining us. And just a couple of things I wanted to note. I would ask that we have two, of course, we're presenting Dr. Veronica, and I call her Dr. V, a gift for her presentation tonight. But we also want to award the first two people who joined in on this presentation. So we have Miss Belinda Goolsby and Miss Daisy McQuarrie. And Miss Daisy, we have your information, but Miss Belinda Goolsby, we don't have your information. So if you could either put it in a chat or give me your email somehow. I mean, if you wanted to, I don't know if you can chime in, but if you would put it in the chat, put your email in the chat, we will get back with you and then get you that gift card. But thank you so much. So the two prizes go to Miss Belinda Goolsby and Miss Daisy McQuarrie. Thank you so much. I would ask that also that all Target 2 committee members, please stay on the Zoom after we're all finished. And we have just a couple of wrap-up things that we want to do. And so my part of the closing, instead of a meditation, I just wanted to piggyback or chime in on Dr. Veronica's presentation. And this is also, in addition to Heart Health Month, this is also Black History Month. And so I'd like to read a poem by Maya Angelou. And I think it ties in well with this evening's presentation. And just remember to take from it, eat more of the foods that are good for you and less of the foods that are not. And so here it is by Maya Angelou, The Health Food Dinner. No sprouted wheat and soya shoots and Brussels and a cake, carrot straw and spinach raw. Today I need a steak. Not thick brown rice and rice pilaf, our mushrooms creamed on toast, turnips mashed and parsnips hashed. I'm dreaming of a roast. Health food folks around the world are thinned by anxious zeal. They look for health in seafood kelp. I count on breaded veal. No smoking signs, raw mustard greens, zucchini by the ton, uncooked kale and bodies frail are sure to make me run to loins of pork and chicken thighs and standing ribs so prime, pork chops browned and fresh ground round. I crave them all the time. Irish stews and boiled corned beef and hot dogs by the scores, or any plate that serves a space for smoking carnivores. So that is Miss Maya Angelou, The Health Food Dinner. And thank you all again, everyone, for joining us. And just wanted to say good night. And Target 2 committee members, please stay on. Ms. Goolsby, do we have your email address?
Yes, ma'am. And also Sarah Patton knows it. And
Okay.
probably Sarah Pam. So
Yes, I've had.
Fantastic.
and I'm with Mu Omega. And thank you, Sarah Patton, for inviting me.
Thank you.
Thank you, Beta Omega. Wonderful job.
All right, Ms. Pam, I will turn it back, Ms. Peppers, I will turn it back over to you.
Okay, thank you everyone for joining us. We're glad that you were here with us today, and you have any other questions, I'm sure we might be able to answer them at another time. Thank you so much for coming.
That was a fantastic